So, good afternoon, everyone. I'm Dr. Sayali. I'm the fertility specialist at Oasis Fertility, Pune. So, welcome again for another Facebook Live session. So, as in our previous session, we have dealt with a variety of topics and we had lots of discussions regarding infertility and the various causes and treatment options. So, today, let us deal with a very basic but yet another important topic, that is fertility screening. When, how, and why to do it. So, when a couple is trying to conceive and they are not able to attain pregnancy, then they should go for something known as fertility screening. That is to know their fertility potential, to know what problems are there, that is, affecting their chances of conception. Basically, infertility screening is done in a couple who has been, trying with unprotected sexual intercourse for a period of greater than 1 year. And if the age of the couple is less than 35 years, then the couple should go for an infertility screening. And if the couple's age or the female partner's age is greater than 35 years, then they should go for natural trial for a period of 6 months. If they're not able to conceive in these 6 months, then they should go for infertility screening. So age factor out here is important because once you cross that age of 35, your ovarian reserve, the quality of your eggs, the chances of conception, and the risk of genetic abnormalities, these all tend to increase. Again, early screening for infertility can also be done in individuals who are having females with irregular menstrual cycles or those who are having delayed menstrual cycles. The individuals who are having scanty flow, or if there is any risk of genetic abnormalities in the family, or by any previous scans, they have seen that there is some uterine abnormalities or decrease in the ovarian reserve, or specifically individuals who are working, they are above the age of 30 and they want to delay their marriage or they want to delay the pregnancy. In this case also, they can get their fertility checkup done to know how much time in hand they have, for attaining pregnancies, and is their ovarian reserve good, and is the reserve going to last for the period by which they are planning to extend their conception. Again, in males, if they have a history of any ejaculatory or erectile dysfunction, or if they have a history of undescended testes, trauma to the testes, or any form of infections to the testes, or varicocele or hydrocele is there, or any genetic abnormality is there in the family, then again these can go for an early fertility screening. So now we have seen when to do the fertility screening. So basically, a couple who's having unprotected sexual intercourse for 1 year period and unable to conceive, go ahead with the screening. Now let's come to how to do the infertility screening. Tests for fertility screening in females, these consist of diagnostic tests like the sonographies, where a 3D ultrasound can be done, followed by certain blood investigations and certain tests which can diagnose the tubal patencies. So in ultrasound, a 3D image of the uterus is taken to look for any abnormalities in the uterus in the form of if there is any septate uterus or uterine abnormalities in the form of a unicornate, bicornate, arcuate uterus, or if there is any other obstructing lesion that can affect the pregnancy. Other things that can be seen in a pelvic scan can be the uterus, to look at the size of the uterus, to look at the position of the uterus, to look, for any abnormalities in the uterus, such as if there is any adenomyosis, or, if the uterus is small in size, then this can also be because of some hormonal abnormality. Here we again need to know, look into the endometrial thickness. We have to look if there are any fibroids or any masses that can affect the pregnancies, the position of the fibroids. If they are encroaching close to the endometrium, they can affect the implantation or they can increase the risk of miscarriages. Next, in the scan, we come to the ovaries. In the ovaries, we need to look at the ovarian reserve, that is the antral follicle count. We have to look if there is any form of endometrioma or chocolate cyst or any other cyst, such as the hemorrhagic or any abnormal cyst in the ovary. Then we can look for any adnexal abnormalities, such as if there is any abnormality in the tube, such as in hydro or hematosalpinx, that can affect your pregnancy chances. If there is any fluid in your pouch of Douglas, that can indicate some form of infection that can be affecting your pregnancy, or if there is any para ovarian collection or adhesions or any mass is there. Following the sonography, we can get the hormonal checkup done. And in the hormonal checkup, we have hormones such as the follicle stimulating, the luteinizing hormone. We have the estrogen, the progesterone levels, and the AMH. AMH is basically going to tell us about the ovarian reserve. So AMH value of 1.2 to 3.5 nanogram is considered to be normal. So if the value goes above 3.5, this means that the individual is having an increased ovarian reserve, which indicates that she is falling into the PCO category. So polycystic ovary individuals can have irregular menstrual cycles. They are not ovulating at the right time. They're having problem with growth of the follicles and ovulation. So these individuals can require some assistance in the form of stimulation of the follicles. Next, if your reserve is declining, if the ovarian reserve is less than 1.2, this kind of shows that the reserve is declining and we need to plan the pregnancy faster, because AMH is not something that is going to remain static over the months. It is going to decline. So the time in hand to achieve the pregnancy is lesser in individuals who have a low AMH, and problems relating to ovulation, getting good quality eggs, are there in individuals who have a higher level of AMH. So these are the individuals which require some form of assistance or some form of treatment to attain pregnancy. Next comes your follicle stimulating and luteinizing hormone level. So, in individuals who have abnormalities in these hormones, individuals who have something known as hypogonadism or hypogonadotrophic hypogonadism, where the hormones are not adequate. So, these hormones are not going to stimulate your ovaries to, produce those follicles to release these eggs. Therefore, some form of hormonal treatment can be given if these values come to be in the lower range. As we have said, individuals with PCO also have hormonal abnormalities, and in these individuals, the LH or the luteinizing hormone level is on the higher range, and the LH and FSH ratio is also altered. Whereas individuals who have a declined ovarian reserve, where the number of follicles or the antral follicles or the AMH is on the lower side, these individuals have a higher level of FSH. Another hormones such as the estrogen, the progesterone can be done. Along with that, we need to get the thyroid and the prolactin hormone level tested, because these can also impact the chances of getting pregnant, or they can cause problems in continuing your pregnancy. Uh, Other tests that are to be done is to know the hemoglobin level. Individuals with a low hemoglobin level can be weak, and they also can have scanty menstrual flow. We have to know about the sugars, because quality of the eggs, ovulation, and things, or even chances of attaining pregnancy or continuing pregnancy is slightly lower in individuals who have delayed sugars or diabetics. Then we have to go into the infectious screening, where we do the rubella marker. We have to go for the viral markers such as the HIV, hepatitis, HCV. So all these tests need to be done. So following that, we also need to know about the tubal patency, because tubes are an absolute requirement if the individual wants to try attain pregnancy by the natural route or by the process of IUI. So it is here that the egg is going to come, and the sperms are going to meet the egg, form the embryo, and the embryo is going to be nurtured for a 3 days period, and then from the tubes it is going to be transferred into the uterus. So the initiation of the pregnancy, or the initial step of pregnancy, we do require the tubes. So we have two tubes, that is the right and the left side. So by doing the tubal patency, we need to know if there is any form of blockage in the tubes, or any form of abnormalities in the form of hydrosalpinx, hematosalpinx, that can affect your implantation process. So if there is any blockage which is seen by a hysterosalpingogram, sonosalpingography, or saline infusion sonography, any of these tests can be done to know the tubal patency. And if both the tubes are blocked, then in that case we can go ahead with a laparoscopy procedure and try to remove the blockage. Or if any one of the tube is blocked, we can either go for a laparoscopic procedure, or we can try to get the multifollicular growth and ovulation from the side where there is no blockage. In individuals who are younger but who have a lower ovarian reserve, or individuals who are having recurrent pregnancy losses, they are attaining pregnancy but they're not able to continue the pregnancy, or individuals who have had repeated cycles of treatment in the form of IUI, in the form of IVF, with multiple embryo transfers and are not able to attain pregnancy, then in these individuals we also need to get the genetic testing or the karyotype done, to look if there is any abnormality which is affecting the quality of the embryo or the potential of the embryo, to advance and continue the pregnancy. Next comes the screening in male individuals. So, in the males, the most important test that we should go ahead with is the semen assessment. So, in the semen assessment, we have to make sure that the individual gives the sample with an abstinence period of at least 3 to 4 days. He has completely ejaculated the sample. Now here we need to go according to the WHO parameters, where we require a count of at least 16 million, a motility of 30 to 32%, and a morphology of 4%. Now here this count and morphology will kind of indicate that the individual or the couple can attain pregnancy by the natural way. But in individuals who have a lower count and lower motility, where the morphology of the sperm or the motility is slightly deranged, then we can also add in some antioxidants, some medications to improve the quality, go for lifestyle changes in these individuals, or take some assistance in the form of IUI. Individuals in whom the seminal assessment shows that there's some form of infection, we can get the culture of the semen done to know the source of infection. Individuals whom even after complete ejaculation, it shows that the seminal volume is less. The normal semen volume needs to be around 1.5 ml. So if the volume is less, this means that there is some form of hormonal abnormality. So individuals who have hypogonadism, or individuals who have incomplete ejaculation, or retrograde ejaculation, where the semen is flowing back into the urine, or they have been chronic alcoholic or smokers, or if there is any form of obstruction to the outlet passage, these individuals can have low volume sperm, low volume semen, so we can get them further tested for that. So individuals who are having severely low count and motility, so if the count of the semen is seminal sample is less than 5 million, motility is severely deranged, then in these individuals we need to know the root cause of it. So the cause can either be there can be some failing testicular function, or it can be because of hypogonadism, or it can be because of some obstructive cause. So to differentiate between these things, we need to do the hormonal assessment in the form of getting the estrogen levels, the testosterone, the LH, and the FSH level done in these individuals. So based upon these tests, if the LH FSH level comes up to be lower than 2 to 3, then we can kind of diagnose hypogonadotrophic hypogonadism in these individuals. So these can benefit with the help of these hormonal injections. If the levels are on the higher level, that is, they are more than 7 or 8, then in these individuals they are going towards testicular failure. So we have to plan the pregnancy as soon as possible, add in the antioxidants, the other medications, where you can improve the quality of the sperm, ask him to go for lifestyle modifications. Individuals in whom the FSH value goes above 10 or 12, then the chances of attaining sperms also kind of declines. Testosterone level is another important hormone which is required for spermatogenesis. So if the level of these hormones is less, we can give them the desired treatment to get these hormonal level increased and see whether the sperm production is improved. Yet another thing is if individuals have a prolonged history of smoking, alcoholism, or they are diabetics, the sugars are deranged, or they have a deranged lifestyle. In these individuals, the sperm motility, the morphology, or the quality of the sample can be affected, and so can be the count. So in these individuals, along with the seminal assessment, we can also get the DNA fragmentation index done, which will help us to know the percentage of DNA abnormalities in the sperm, and if the DNA abnormalities percentage goes more than 25%, then we can resort to procedures such as max or microfluidics to select those specific DNA normal sperms which can be used for attaining conception. In individuals who have a count less than 5 million, or where the motility is severely deranged, in those individuals we can get the genetic testing done. We can get some tests like the Y chromosome microdeletion done, or individuals who are having azoospermia or cryptospermia where the count is very less. In those individuals we can even go for a CFTR gene mutation. So here are the set of tests or screening tests which can be done in a female partner and the male partner. Now comes, why is this screening necessary? So as we have all seen that a couple is trying to conceive, for 1 year period or a 6 month period, not able to attain pregnancy, going ahead doing the same thing and then reaching a point where maybe your fertility consultant also won't be able to help you. So it is necessary to get the screening done. It is necessary to find out the precise reason what the problem is, how much time you have in hand to attain your pregnancy, and likewise you can move ahead with the treatment options or even the natural try if you want to take that. So, early screening for infertility will help us to know the fertility potential of the individual or the fertility potential of the couple. It will help your doctor to know how much time you have in hand to attain pregnancy. It will help your doctor to know the exact reason, for which you're not attaining pregnancy, and it will help them to correct that, and we can also find the best treatment options available for you. So, as we have said, that there are some minor abnormalities in the form of PCO or slightly decreased ovarian reserve or minor derangement in seminal, assessment. And here we can go for an ovulation induction or time intercourse, or even we can go for an IUI. But if there are severe abnormalities in the form of some genetic problems, is there, or the severely declined ovarian reserve, or the individual is having severe decrease in the count, motility, and by which by a natural try or IUI we cannot give you that chances of attaining pregnancy, then you can move ahead with an IVF or ICSI process. So definitely these screening tests will help us to find the reason. In males, it can be a decrease in the semen count, motility, or the quality of the semen. This can be because of some obstructive causes. This can be because of testicular dysfunction. Some hormonal abnormalities such as a hypogonadotrophic hypogonadism can be there. Or it can also result in ejaculatory or erectile dysfunction because of low testosterone level. In females, it can be because the causes of infertility can be abnormalities in the ovarian reserve in the form of high ovarian reserve, where the individuals might have PCO, declining ovarian reserve, where the AFCs or the antral follicular count will be on the lower level. Uterine abnormalities in the form of some septate or bicornate or unicornate uterus, or the lining is not developing, or there's any form of adhesions inside the uterus, or the endometrium is thin. If there is any other uterine problems in the form of adenomyosis or fibroids that is kind of impacting the endometrial lining, then by correcting all this, we can get your fertility enhanced. Okay, genetic abnormality testing, as we have seen, can be done in individuals who have some family history, or if they are not able to attain pregnancy, those who have repeated treatment failures, or those who have attained pregnancy but they're not able to continue pregnancy. So I think it's important to get your fertility checkup done. Also, in individuals who are planning to delay their marriages, or who are planning to delay their, chances of attaining pregnancy. So in these individuals, they need to get their fertility checkup done to know how much time they have, what is their fertility potential, so that they can get the desired, treatment options available. So if you're not planning, for marriage, if you're not planning for pregnancy in the near future, if you have some problems with your reserve or there is issues with your age, you can even go for an, oocyte freezing, or even the male partners, if they have some problems with their semen, they can go for semen freezing. So by the time you are ready to go ahead with motherhood, you're ready to attain pregnancy, we can at least have your eggs and sperms. Okay, so I think this is all that I have from my side. Let us see if you have anything coming over from the viewers. Okay, so the question that's coming up is, I have varicocele grade 4 and my sperm motility is also very low. Can surgery the best option for me to increase the sperm count? So definitely yes. So lifestyle modification is one thing. Since it's varicocele grade 4, it is going to severely affect your semen count as well as the quality of it. So surgery will also help you, will definitely help you in this thing. Next question is, do I need to prepare, do I need to prepare in any special way for fertility test? So as we have said, for the male partner to go ahead with his semen assessment, we require a gap period of 3 to 4 months. And in female partners, most of the fertility tests can be done anytime. The 3D ultrasound of the uterus has to be done between, in the late follicular or the luteal phase, that is between the 15 to 20th day of the cycle. But for the assessment of your ovarian reserve and other abnormalities, this is ideally done on the second day of your period. So if you have to prepare in any way, definitely lifestyle modifications, quitting your addictions in the form of alcohol and smoking, especially in a male partner, can revert back his seminal parameters to normal. So get a healthy lifestyle, quit your addictions, and get your fertility testing done as soon as possible. So thank you, everyone. I hope this session has been helpful, and I can see more couples coming over for their assessment and seek treatment as soon as possible, so that we can help you in the best possible way. So if you have any doubts related to this topic or any help needed from us, you can dial the helpline number that is given below, and or you can reach us physically at any of our two centers, that is Oasis Fertility at Veterinary Complex in Kharadi, or even we even have a center in Bakar at this thing, Kaspati Vasti in Bakar. So thank you.